Often we hear about antibiotic resistance, but what does this mean? Bacteria are single-cell organisms. Disease-causing bacteria trigger illnesses such as throat infection or some ear infections. Antibiotics are drugs used for fighting infections caused by bacteria. They reduce illnesses and even death from infectious diseases. However, although antibiotics have many beneficial effects, their overuse has contributed to the problem of antibiotic resistance. Antibiotic resistance occurs when bacteria change so that the effectiveness of antibiotics is reduced or eliminated. The bacteria survive and continue to increase in number, causing more damage. Bacteria can do this through several mechanisms. Some bacteria develop the ability to neutralize the antibiotics. Others can pump the antibiotics out of the cell, or even change the antibiotic attack site so it cannot affect the function of the bacteria. Exposure to antibiotics, therefore, provides selective pressure, which makes the surviving bacteria more likely to be resistant and hence continue to proliferate. The resistance is usually coded by DNA and can be transferred to other bacteria. Antibiotic resistance is a global problem for all of us. Some infections cannot be cured today with our current antibiotics.
This is Amala. She was born only a few hours ago and has a serious blood infection called septicemia. You would think that antibiotics would work for her infection, but we are finding more and more cases where antibiotics can't kill some bacteria. Antibiotics cure infections, but for years we have taken too many of them, and often for the flu or a common cold for which they do not work. This has made many bacteria resistant, which means that antibiotics will no longer work. Unfortunately, the overuse and misuse of antibiotics are making bacteria grow stronger and resistant to antibiotics, and there are few antibiotics being developed. What can you do? Always seek the advice of a healthcare professional before taking antibiotics. Only take antibiotics when you have a prescription and do not self-medicate. Also, wash your hands and practice good hygiene at home and in hospitals to prevent bacterial infections in the first place. Thankfully, Amala didn't have a resistant bacterial infection, and the antibiotics prescribed by the doctor worked, and she recovered from an infection that could have killed her. We must act together to make sure that our antibiotics remain effective for when you and your children need them. Antibiotics are a precious lifesaver, so let's handle them with care.